Good afternoon. I'm Dawn Carr and I'm the UCAN Health Outreach Officer. And I'm also the coordinator of This Is My City Birmingham, which is part of the Black Health Matters Summit. And I'm honoured to introduce today Dr. Jackie Dyer, who has an MBE, and she is the president of the Mental Health Foundation UK and also an independent health and social care practitioner. Jackie was the vice chair of England's Mental Health Task Force, which collaboratively developed the 5-year forward view for mental health and the transformation of mental health services and its policy and provision. She was also elected as a Lambeth councillor and is a deputy leader on leads such as jobs, skills and community safety. Jackie is also the co-founder and chair of Lambeth's Black 5 Partnership, whose goal is to improve mental health and the well-being of the African Caribbean community and its African citizens in Lambeth through addressing the systemic inequalities and structural racism in Black mental health. This is a social enterprise that was set up as a direct partnership to take forward the legacy of the Black Thrive Global organisation, which Jackie founded. Jackie, I want to thank you for being with us today.
Thank you, Dawn, and greetings, everybody, wherever you are. So I wanted to sort of honour what Black leadership can achieve when it's focused. So our Black leadership impact is the title of my presentation. Not everything that is faced can be changed, but nothing can be changed until it is faced. James Baldwin. The positive impact of Black leadership when focused upon improving the health and well-being of Black people through systems change. Black leadership. So I am the co-founder and director of Black Thrive Global, the co-founder and director of Oxytocin Learning, and nationally, I'm the Mental Health Equalities Advisor for NHS England, which is our National Health Service. And I'm also the Mental Health Equalities Advisor for Health Education England. And as been said, the president of the Mental Health Foundation UK. And at a regional level, I co-lead Thrive London. So, national Black leadership. As chair of the Advancing Mental Health Equalities Task Force, in October 2020, we produced an Advancing Mental Health Equality Strategy to drive forward the focus on addressing mental health equalities across all protected characteristics. And when I say protected characteristics, I mean those that have been identified, including race, gender, sexuality, by our legislation, the Equality Act. And so, in essence, the strategy is about making real the intentions of the equalities legislation and the Human Rights Act. I also chair the Patient and Carer Race Equality Framework Steering Group. The PCREF, Patient and Carer Race Equality Framework, for short we call it the PCREF, is a Mental Health Act review recommendation in 2018, which was devised to address the disparities in mental health service provision and the outcomes for racialized communities. I'll speak a little bit more to that. And immediately after the review, the then Prime Minister, Theresa May of the government, and the Health Secretary, Matt Hancock, agreed to this recommendation being developed immediately because the situation in terms of the racialized experience in mental health service provision was perceived to be so urgent. And that recommendation, along with culturally appropriate advocacy, is being led at a national level. I also chair Health Education England's Mental Health Workforce Equality Subgroup. And it is of note that the total mental health funding for England has increased from 11 billion in 2015 to a planned 14 billion in 2020-21. And that kind of gives you the context of the level of influence, potentially, of these agendas. So in terms of the Advancing Mental Health Equalities Task Force and the strategy, as I said, are underpinned by the Equality Act and the Human Rights Act. The Advancing Mental Health Equalities Task Force is owned at a national level and has a program board, the Mental Health Program Board, for which gives national oversight and direction to ensure that the equality strategy is both purposeful and the intentions are actually realized. So the governance of this at the highest level for England is critically important. And the task force is made up of members that range from experts by experience to policy and delivery experts to mental health sector experts. And it attends to data, transformation, and policy. So in terms of the strategy, the key elements of that are around helping local health systems to improve. And there sits the patient and carer race equality framework. A key area is around improving data and intelligence so that we are using good data to inform decision-making about how resources are deployed in order to respond to people when they are at their most vulnerable in terms of their mental health challenges. And the other area is around the workforce, ensuring that a workforce is fit for purpose to deal with racialized communities and other protected characteristics when they are at their most vulnerable. And so the short and long-term actions to advance mental health equalities in England in this strategy has three key objectives: supporting local systems, improving data quality and use, and paying robust attention to the workforce. Helping local health systems to improve. The Patient and Carer Race Equality Framework essentially is an accountability framework that will propel organisations to be anti-racist through co-production with its racialised communities, thereby improving mental health service experiences and outcomes for Black people. The framework has made significant progress in terms of its development. We are working alongside 4 pilot trusts located in Birmingham and Solihull, Greater Manchester, East London, and South London. We've had a range of deep dives into differential ethnic minority experiences within mental health service pathways, and building upon the above, as well as the Mental Health Act review I mentioned earlier, we've identified 10 potential organisational competencies, and we continue to engage with patients and carers and community members on these potential competencies, with further engagement in the pipeline, including rolling out a feedback questionnaire amongst the 4 PCREF pilot sites shortly. And we will be doing a wider consultation towards the end of the year as we further develop this PCREF, which is due for launch in 2022. So in order to improve the experience of minoritized communities within mental health services, there are 3 components of the PCREF. One is the statutory and regulatory obligations. So within that, how are mental health service providers fulfilling their equality duties, their Mental Health Act duties, their workforce race equality expectations, etc. And we are working very closely with regulatory organizations, including the Care Quality Commission and the Equality and Human Rights Commission, in order for them to help monitor organizations that they will be delivering with the racialized experience central to demonstrate progress on achieving better outcomes for those groups. And in England, the disproportional experience of poor experiences and outcomes for people of Black heritage, African and Caribbean heritage, has been going on for decades. Part 2, organizational competencies. And these competencies are around how services can be more culturally responsive. There will be guidance on how to identify any additional local competencies beyond the national, and advice and support on how to build upon these competencies. And then, most essential to the PCREF, part 3, is a feedback mechanism whereby the lived experience of people from Black communities will be able to share whether or not their experiences are improving. And that feedback, be it through culturally appropriate advocacy or through themselves providing feedback, will be a critical part of helping the organizations to equality improve. And these are some of the organizational competencies that have been identified thus far: co-production, leadership and governance, co-learning, staff knowledge and awareness, partnership working, cultural awareness. The workforce, a critical part of this work, for without the workforce being fit for the purpose of providing anti-oppressive, anti-discriminatory, and anti-discriminatory, anti-oppressive, and anti-racist provision, then we will continue to see the disproportionality and differential experiences. So in the work that I do with Health Education England, there are particular work streams via the Workforce Equalities Implementation Project to address these issues, to improve the workforce across all mental health disciplines. And those work streams, working groups, are careers, pathways, and opportunities to ensure that they are inclusive of all groups, communications, marketing, and engagement, retention of a diverse workforce, and curriculum development, so that we ensure that the curriculums provide and equip the workforce to be competent around race, inclusion, and diversity, and an equality impact assessment. So how did Black leadership come to be leading at a national level on this agenda? That experience has been derived from a local level, as in my role as a councillor within Lambeth Council, and from which, because of the lack of attention to the Black experience, I founded and chaired the Black Thrive Lambeth Partnership, a partnership for mental health and well-being in the Black community. So due to structural barriers, Black people are significantly overrepresented in inpatient settings, 4 times more likely to be detained under the Mental Health Act, underrepresented in child and adolescent mental health services, more likely to express dissatisfaction with mental health services, and impacted by institutionalized racism. We created Black Thrive Lambeth off the back of working with our communities and co-producing a series of recommendations in partnership with our communities, our voluntary sector, and our statutory sector, to improve access to and experience of mental health services and prevent mental ill health in Black and mixed communities. It is a partnership that is underpinned by the collective impact model and focuses on systems change. And this is from the birth to where we are now, which is around really delivering our programs to transform the experience of our Black communities. And the collective impact infrastructure is, as you see, made up of a steering group and a facilitation team. And in the ecosystem for Lambeth, we are focused through our partner-driven action upon transforming experiences for children, young people and families, working-aged adults and older people. And this is underpinned by data, which we compile using a shared measurement system across data, which is pulled together across all our partner organizations. These are some of our priority areas, including culturally appropriate peer support and advocacy, our work at that local level about helping to co-produce and develop the PCREF within South London and Maudsley Mental Health Trust, and decolonising knowledge production, amongst other things. We absolutely place the voices of communities at the centre of all that we do. That is the way that we work, to transform services, to influence policy, to test new ways of working and delivery, and to decolonise the knowledge production process. So these slides are going to be shared with you, by the way. So these are some of the quotes around some of the Black experience. So for example, I fear that with Black men, there is a fear of looking weak amongst each other, because there is that fear. I don't want to look like a weakling. I'm not this, I'm not that. They don't want to show that vulnerability in front of each other. We have to create safe spaces where our Black communities can heal and share their experiences with each other and ensure that we move towards experiences wherever they're located, where they are not feeling oppressed and dehumanized. So what can you do to reduce mental health inequality? You can think and act in systems. You can collect, analyze, and act upon equalities data. It's no longer sufficient for us to keep describing our trauma, our racialized trauma, all the data, year upon year, decade upon decade. The time now is to act upon that data in a way where we are working with our communities to co-create what those responses to their challenges are. One of the reasons why I'm a local councillor and the deputy leader of the council is so that I can really influence and help to shape at that political level the social determinants of poor mental health. So when we think about education, employment experiences, skills, these opportunities must be created in order for us to transform the experience of our Black communities from one where they are excluded or detained or killed. So offer your skills to benefit the community. In the Black Thrive Partnership, it really is about working together and create a working culture that creates safe spaces to talk about mental health and racism, and review your policies and practices to make sure they are inclusive. I'm really inspired by Claudia Rankine, and one of her poems in her book, Just Us. I will read the last part of that poem. What if what I want from you is new, newly made, a new sentence in response to all my questions, a swerve in our relation and the words that carry us, the care that carries. I am here without the shrug, attempting to understand how what I want and what I want from you run parallel. Justice and the openings for just us. Thank you. And before I end, I would like to speak about why personally this is such an important agenda. And I think this speaks to so many people because perhaps my own personal agenda, my own personal experience mirrors that of so many others. I recently had the anniversary of the second death of my second sibling, who died at the age of 54. after 30 plus years in mental health services that fundamentally failed him. He died 6 days after the death of George Floyd. My youngest brother, my baby brother, died at the age of 41 in similar circumstances. So my driver for improvement, for the life chances and the experiences of our racialized communities is very much personal as well as professional. And I think it's upon us to use our own personal energies, our own personal commitments to our communities, because we are a family, which is why we are Black Thrive Global. And that is the intention and the motivation of why we exist. Thank you. So I'm hoping that I can see where the questions are so that perhaps I can answer some questions that arise. Okay. I hear a comment here, which is really quite useful. If patients can provide feedback in a video or audio format, it can provide improved feedback from patients who cannot read. And that is utterly an inclusive approach. And I think that we will look at that patient and carer feedback mechanism to make sure that it's not just about providing feedback in a written format. So thanks very much for that. And what is the most vulnerable population in the UK for mental health related issues? Quite outstanding. The most shocking figures in terms of vulnerability around mental health challenges is people of African and Caribbean descent and gypsies and travelers. And it's been an ongoing pattern for many years, but one has to understand it from a systemic point of view, because it is a combination of systematic and structural racism and oppression, where we don't have opportunities to thrive, opportunities to advance in our lives, that create a whole storm of factors that lead us to be more vulnerable. We are not naturally vulnerable. It is a creation through structural inequalities that create that. The policies, the actions, the legal, in housing, in employment, in education, that create all these barriers, all these problems for us, which means that we cannot advance. And I would challenge anybody who comes from our white counterparts, if they were to experience the level of challenges that we have, that they too would be overrepresented in the mental health service population. We will make sure, sorry, somebody said that the Twitter name on my slides are wrong, maybe wrong. So it's at Black Thrive. We'll make sure that you get the correct information. And thank you for your condolences at the loss of my brother. And somebody else is asking to speak. And I think that there's some recent data about the increases in young Black people and even adults of working age committing suicide. I think the factors remain the same, that if you are excluded from being able to flourish in your life, then you are so dehumanized that you just lose hope. And in that hopelessness, the risk of thinking about suicide and so forth takes set. And in this time of post-COVID or during COVID, we see in our country that the stark inequalities that Black people were already experiencing are further exacerbated through COVID. I know in my borough where I live, the increase in people who are unemployed is 100-fold, and yet there are very few services that are really attending to this stark reality, and the disproportionate makeup of those who are unemployed remains the same. They are Black people, particularly our Black young men. So I'm sort of like looking for, is there some people in the chat? So for example, with Black Thrive works with our local mental health trust to support frontline workers in engaging with the agenda. So the mental health trust, in terms of the PCREF, which is a pilot site, has embodied the whole of the PCREF into its corporate strategy. So within the corporate strategy, there is a commitment to anti-racism, and at every level of the organization is an embodiment of working through and with the PCREF. So across the trust, frontline mental health workers, managers, directors are working with communities such as Black Thrive to help transform the services. And this is proved quite exciting for a lot of the workforce who want to be joined in a movement that helps to improve what they experience and know has been so poor. So we have PCREF activists and PCREF allies. And so that is really so inspiring to know that people really want to get on this agenda. And at the same time, I think it's really important that in terms of it being an accountability framework, being able to present back to the community with integrity the progress that is being made around changing the experience, transforming the experience, changing the services so that they better respond to the very differential reality of people from racialized groups is a really important to communicate with communities so that we develop trusting relationships. Because to date, actually people from Black communities do not trust mental health service provision because they fear that they will die if they go into mental health care, which leads to our Black people more often than not coming through the services in crisis rather than an earlier point, i.e. early intervention, because they don't trust. So how do we co-create early intervention services to better respond to our population's needs? And that's the beauty and the power of the PCREF. So I've come to the end of my presentation now, and I want to thank you for taking your time to be with me today. Please enjoy the rest of the summit, and please do visit the Black Thrive Global exhibition for more information and inspiration about what is possible through what we do. Thank you.